for a few days and we get a new machine. Alright. GE LOGIQ E10. Oh, word. It goes up to 24 megahertz. Alright, so here's a quick breakdown of the new machine. LOGIQ E10, GE LOGIQ E10. We've always used the LOGIQ E9s, so this is the new one. Screen, pretty much the same. Nice flat base. Here's the touch screen. Alright, so here's your choice of transducers. What I don't like about this new machine is that it doesn't have the external TGC buttons. It has a slide here, so you click on here. And you can adjust the TGCs this way. I don't like it. One thing that I think they've actually added intuitively is usually when you're using the TCDs, you kind of will do motions like this. That's pretty much how I use it, although I do a lot more fine tuning, right? I'll do a lot of more fine tuning. I don't know if you can do that here. Well, actually you can. All right, so that's not that bad. Okay, that's not that bad. That's pretty much how I use it intuitively. All right, so I redact my statement. That's fine. But there's also this right here. So near TGCs would be these, and you can kind of just scroll them. So if they're like set in a line, you can kind of do like a nice little curve. And then far TGCs, click down, and it's the same thing. All right, so not too bad. I guess I'm not a boomer after all. I can deal with that. I like that. But whatever. Obviously, you have the normal stuff. Choose your patient, new patient, blah blah blah, all that stuff. Scan is the same thing as pressing the B button. It's the same thing as pressing the unfreeze button. All right. Let's see what else. Utility. That's to change all the parameters of the machine. And exam is obviously to end the exam. All right. So the touchscreen is nice. Looks like an iPad. Looks like a like a Tesla. Pretty. All right. So once you have your patient chosen, you can choose whatever transducer you want. If you're doing an abdomen complete, you're usually going to go with C16. This is the C16. Pretty much identical to the ones from the LOGIQ 9. I'm sure it might have maybe some updates. I don't know, but it looks very similar. All right. So the other transducers are the C29, which is we had on the other machine too. This is used for pediatric abdomens and stuff like that. It's like the smaller baby version of this one that has higher megahertz. So it goes up to 9 megahertz. Sweet. Then we have the L29, which I suppose is the new version of the 9L. And I've already used it, and it takes very, very beautiful pictures. I'll try it out right now. Alright. New also is the linear hockey stick. The other one used to go to L18. This one goes to 24. I've also used it right now. Here's an example. Alright, so more on transducers. You have the ML615, great for thyroids. You can also use it on appendixes if they're very thin. You want to get a nice picture. Same thing with this one. I use this on sometimes real small patients that have appendicitis. Want to get nice pictures, like the example I just showed. Thyroids, testicles, musculoskeletal. This one is also available on the other machine. C310, really good for baby brains. Right. Also can be used for neonatal abdomens. Very nice. You can use this for vascular neonatal abdomens if you're doing like renal Dopplers and stuff like that. Beautiful. An endovaginal probe. I haven't used this at all. We work in pediatrics, so I don't really use this. I guess maybe this machine's a demo. I don't know. And this 3D probe, which is great for obstetrics, but I will try to see if I can incorporate this into some imaging to see if I can just get some 3D images of things we don't normally do 3D images of, just for, just for curiosity and learning purposes. So once you choose your transducer, you can choose what setting you want to use. If you're using abdomen, obviously abdomen. We also have a section there for bowel. If you're using this one, you can choose your maybe musculoskeletal settings. We use that one always for appendix. The L9 for appendix always, so I'm gonna use that one for appendix too. So we have appendix, as you see, you have other things there, wrist, scrotal. Now I would only use that for a scrotal if it was like very swollen or a lot of edema. But for a regular scrotal, you use the 15. So frame average and frame rate, I always keep those low. Oftentimes I'll put these at 0 too if I'm getting too much motion artifact. I really like this keyboard. It's soft. It doesn't clickety clack like the old one. I actually like this a lot. It still gives you a little click. All right, I like that. So if you type a bunch of stuff you don't want to keep, you keep that clear button, and then it goes away. Right, so obviously your letters, very simple. There's usually a letter up here for print screen right here. And it's the same thing as using this. So you can use this and it'll take an image. I never use that. LOGIQ apps, I don't know what that's for. Maybe that's to connect with technical support. Don't know. 3D, 4D button is obviously for that 3D probe. Elasto is for elastography. Never use that. LOGIQ view, this is for panoramic views. Let me show you real quick. All right, so if you want to do a panoramic view with the LOGIQ view, you gotta find your spot, press the L button. All right, I'll use the end of my radius there, and then just track. Nice and steady, you can kind of fix it as going along. This is just an example. It's not gonna be my best panoramic, but. And then when you're done, press the R button, and there you go. You have a panoramic following the radius and the musculature. So that's LOGIQ view. Then you have M mode, which is you can use it for motion, any motion of anything really, but you can use it a lot in cardiac applications, fetal heart rate. Use it also for diaphragm movement. Here's an example of my left parasternal long axis-ish view. And there you can see the M mode at the level of the mitral valve. So this is obviously not very optimal. This is the current probe. We don't even have cardiac presets on this machine, but just so you can get an idea. Okay, this knob is for depth. So if you want to go shallower, you go up. If you want to go deeper, you go down. And then it also has for, if you twist it, you can narrow your field of view or make it wider. And then if you turn to the right, you can steer. I never really use the steering, but I do use the zooming up a lot. So you have power Doppler, which we use a lot, or I use a lot at least, D-flow, which I use a lot as well, and then harmonics. Turn it on or off. I usually always have it on. Sometimes I'll turn it off, depending on the patient. When you hit color flow, some more stuff comes up on the screen. So you have slow flow. If you want to pick up, tight stenoses, if you have that, you can press that and pick that up. Or if you're doing like a renal artery or intrarenal flow, you can use the fast flow or penetration for larger patients. And then you have the radiant flow, which is real pretty. This is an example. Here's a color Doppler on the carotid, on my carotid. And there's radiant flow in the portal vein. Almost looks like an upside down blue. Alright, so this one's spectral Doppler. You click it on to turn it on, and obviously gain higher to the right, lower to the left. Here's an example. Very nice. I have the radiant flow there as well. Alright, now let's look at some cases. This is an appendix and transverse with a 9 MHz transducer. You see, the image is extremely clear. It's measuring about 1.5 centimeters. This is with the radiant flow. Look how pretty. And this is sagittal. Look how clear you can see the gut signature. And here's a pancreas and transverse. Look at that, how clear. And this is another appendix with the L22 MHz transducer. Not in a baby at all. And this is just amazing. This is sagittal. Look how you can see the layers of the wall. You can see the debris inside the gallbladder. And there's free fluid there. Okay, hope you enjoyed this quick demo of the new LOGIQ E10. Thank you. Bye. Might be a little echogenic because he might have some mesenteric adenitis. So here's the little lymph node is a little prominent. So I did the radiant flow on the lymph node. Nice. Measured it about 1 centimeter. And then a couple of the smaller lymph nodes. And then you can start seeing the appendix right there with a 24 MHz transducer. Again, 24 MHz. It's crazy. So dual with compression. See how much it compresses down to 3 millimeters. Again, this is psoas muscle. And here you see the appendix. And sometimes the appendixes are pretty long, so I like to show it in segments. If I can't get it all in one image. Iliac artery, iliac vein, psoas muscle. And then you can see the appendix draping over the iliacs. Here you see a good section of it. And then finally the tip. Right there, and then transverse to the end, and then that's it. I found his quick. Here's the appendix. Here's the iliac artery. See, it's tiny, looks normal. That's in sagittal. This is with a 9 MHz transducer. Bladder. And then he had some diarrheal symptoms, so I happened to go onto the left side, and his descending colon was very thickened. So this is the colon right here. You can see it's pretty thickened. About almost 7 millimeters in thickness. And then this is sagittal. So here you see about the sigmoid colon region. Below this is the bladder here. Below this would have to be the rectum. So sigmoid colon and descending colon, very thick. So no real hyperemia. Sometimes with patients with Crohn's, they'll have hyperemia and a lot of fat stranding. And this is with the 24 megahertz transducer. You can see that line, which we're kind of seeing here. Which somebody will see that, like, oh my god, is there like, you know, ascariasis or something like that? But no, it was just an actual serosal lining of the bowel. This is very echogenic. So again, 24 megahertz transducer and some fat edema next to the bowel. So here, a tiny bit of free fluid, again, bladder. And then this is a panoramic. And here you can see the external and internal oblique and transversus abdominis muscle. And you see the entire length of the thickened bowel. Oh, and then the left kidney up here, of course. I like to do panoramics a lot. Okay, next case is another appendix. Sorry guys, I do a lot of appendices. So yeah, again, right upper quadrant. Gallbladder. Many times since I do the appendix with the linear, I just start with the linear. If they're slender, if they're a little bit bigger, I'll start with the curve. But almost every time I'll start with the linear because you can see there's just limited images of the gallbladder and right kidney. Right? And transverse, and then go down to the source of the pain. There's thickened, a little bit of hyperemia. Again, psoas muscle here. Non-compressible. You can't see it over here, but it's 0.98, so about 1 centimeter. So you can see 0.98 centimeters. So 9.8 millimeters. You can see some fecal material within there. And sagittal, pretty plump. That's the tip right there, iliac artery. Empty bladder, uterus. And then with the 24, and wow. Look at the fluid levels with the fecal material inside the appendix. The fat stranding. Look at that. Amazing. So here I'm getting it about 1.1 centimeters. 1.01 centimeters, sorry. And then this sagittal. Looks pretty prominent. Fat stranding. You can see subcutaneous fat too. And that's a clip. And this in transverse. Alright, next. Okay, next is I think a liver gallbladder. I don't remember this one, but same as the abdomen, complete beginning of the liver, left lobe, aorta. I like to get the aorta try to straight here so you can use TGCs to clean out any echoes that are always going to be behind the SMA region. And then with the radiant flow, looks like candy. Looks nice. I think color Doppler still does better because there's a lot of like artifactual elements here. Alright, caudate lobe, ligamentum venosum, IVC with the radiant flow. Cool. Alright, beautiful. Sorry, my thing messed up. Alright, so here's the right kidney. You see the radiant flow in the kidney. Look how awesome that looks. Alright, so measure the liver. It's normal. And then transverse. So again, left lobe, superior to inferior. Finally reaching the pancreas. And then I'll focus on the right lobe again. Nice hepatic veins. Nice portal veins with the branching. Left and right. The right posterior. The right anterior. Gallbladder, ligamentum teres. Nice gallbladder. Measure the wall. CBD. Portal vein with the hepatic artery with the radiant flow. A little bit of IVC too. Left lateral decubitus for the gallbladder. Make sure there's no hidden stones. Alright, so that's ligamentum teres there. He had a little bit of echogenicity here. Now, many times people call that hemangioma, but that's actually a pretty common finding near the ligamentum teres. It's a focal fatty infiltration, pretty common, but a lot of people misdiagnose that as a hemangioma. You see there's like no flow at all. So this is my pancreas protocol. So luckily it's not an appendix. So I begin in the epigastrium, pancreas transverse. You got that little bit of uncinate process, head, body, some of the tail there with some shadowing of bowel gas, more of the tail there. With color. Try to get every angle I can to get more of the tail. You can see the left kidney. There's a portal splenic confluence. You can see the portal, the splenic vein with radiant flow. This is a nice view of the IVC. Even though I'm trying to get the pancreas to sag, this is IVC with the right renal artery. Pancreas to sag body, tail. I angle towards the spleen from the tail to get a longer view in sagittal. Radiant flow. And this is with a linear probe, 9 megahertz. Pretty much repeating the same thing. Patient can drink water, you have them fill their stomach up completely, and you get a good view of the pancreas as well. Alright, we'll just finish it up with this last one, which is another appendix. So, gallbladder, right kidney, transverse gallbladder, right kidney, liver, and then you can go downstairs to the right lower quadrant. Alright, so like right lower quadrant, sag, a couple of lymph nodes, probably ileum there. That's probably already colon. You can see the haustra. A little bit of free fluid. I was having trouble seeing. Usually when I start writing, instead of going directly to the appendix, I start right lower quadrant taking images. It's because I'm searching. A little bit of free fluid, so I'm searching more. Iliacs. And I do the bladder. Some free fluid behind the bladder. We see this quite frequently, not that big a deal. And then finally I found the appendix. So transverse. You can see it also has material inside. A little bit of hyperemia with the B flow and the power Doppler. Non-compressible, 9 millimeters. Wall thickening for sure, greater than 2 millimeters. Hyperemia. And then that's the tip of it in sagittal. And then this is proximal appendix coming off. So this would be cecum here, coming off the cecum. Hyperemia, and then with the 24 megahertz transducer. Look at that. One thing for sure, these very high megahertz transducers make everything huge. So here's your appendix. That's the wall there. You see the material inside. Hyperemia, fat stranding, looks like thyroid. See this clip. The transverse. And then sagittal, look at that. Look at the layers of the bowel, the 5 layers. What we call the gut signature. That's just cool. Machine. So first case is a brain. It's a normal brain. It's a good time to show the protocol. I start all the way anterior, right by the orbits. Here you have the interhemispheric fissure. And then a little bit back, you got the sylvian fissures. Kind of nothing in here. Interhemispheric fissure. Temporal lobes on here. Lateral ventricles. Cavum septum pellucidum. Third ventricle. Sylvian fissures. Temporal lobes. Again, third ventricle, much clearer seen. Lateral ventricles. Corpus callosum. Then we go up here by the tentorium. Here's the cerebellum. Chorioplexus. Cavum vergi. If you see this, put some color Doppler on there because that could appear to be a vein of Galen aneurysm, but that's not the case here. And then all the way posterior, using periventricular white matter in the occipital lobes. Right, sagittal midline, corpus callosum. You have the rostrum, genu, body, and splenium. Splenium is always in the back. You got your thalamic adhesion, or your midline thalamus. Third ventricle, cerebral aqueduct, or aqueduct of Sylvius. Fourth ventricle, cerebellum. Anterior, posterior. Then I go to the right, show the caudothalamic groove, caudate nucleus, thalamus, chorioplexus, and lateral ventricle. And then all the way to the lateral part of the right side, your sylvian fissure, periventricular white matter. And then the same thing on the left, caudothalamic groove, check for bleeds in this area, and then lateral. So as you can see, these images are very similar to what you would get with the LOGIQ 9. This is with the C310, the little micro-convex array probe that is just fantastic for these studies. So then, here's the color Doppler. Then we do transverse. So this is transverse temporal. Here you can see where the circle of Willis is going to be. Right there. And then mastoidal, you can see the cerebellum, fourth ventricle, a little bit of posterior fossa fluid, which is normal. Beautiful. And then I pretty much repeat everything with the 9. Now this is the new 9. The old 9 was a 9L. This is a L2 9, I think. Yeah, L2 9. And I'm on the frequency of 9. And the images are just fantastic. Here you see, I either raise the TGCs a little bit. See that difference? Okay. Chorioplexus are normal. Just beautiful. But it's very comparable to the LOGIQ 9. And then when I do the linear, then I take more parasagittal images. So you see caudothalamic groove, thalamus, caudate nucleus, more lateral. Here you have more chorioplexus, occipital horn of the lateral ventricle. And then the same thing on the left. And then this is with a 24 megahertz transducer, L24. So here you got your skin, here you got your superior sagittal sinus. This is a thin amount of subarachnoid fluid, which is normal. And then the pia matter covering the brain. And then the dura matter will be around here. So remember, dura matter, arachnoid matter, pia matter. So DAP, DAP. Here you see just the high resolution brain. It's amazing. And then with color, and that's the radiant flow.